Echo TV is a co-production of Minnesota's Emergency, Community, and Health Outreach Collaborative of health, safety, emergency preparedness, ethnic and nonprofit agencies, and TPT's Minnesota channel.
Hello and welcome to ECHO, which stands for Emergency, Community, Health and Outreach. I'm your host, Lillian McDonald, and we provide educational and emergency preparedness programs in multiple languages across multimedia programs, as well as outreach programs. We provide that for African, Southeast Asian, and Hispanic communities and more. The program this time is on secondhand smoke. We've got two guest experts to join us with some answers to questions. But first, to get an idea of what we're going to talk about, please watch this.
You probably know that smoking is bad for you. Every year, thousands of people die from diseases related to smoking, like lung cancer and heart disease. But did you know that being exposed to the smoke from other people's cigarette smoking is also very dangerous? Smoke from cigarettes contains many poisons that can cause cancer. The smoke that the smoker exhales and the smoke from the tip of the cigarette, cigar, or pipe is called secondhand smoke, and it can lead to diseases even in people who don't smoke. They get sick from just being around the smoke, and thousands of those people die. Nationwide, secondhand smoke causes more than 40,000 non-smokers to die each year from heart disease, including heart attacks and stroke. Children who live in homes where there is secondhand smoke are especially affected. This may be because children are still developing physically, have higher breathing rates than adults, and have little control over their indoor environments. Secondhand smoke can cause ear infections and also trigger asthma attacks in children. Asthma attacks are worse and happen more often for children who live with smokers than for those who do not. Exposure to secondhand smoke can even cause sudden infant death syndrome. Every year, more than 400 babies die from sudden infant death syndrome because they were exposed to secondhand smoke. There is no safe level of secondhand smoke, so you should try to avoid it if you can. Even with stronger smoke-free laws, many people, both children and adults, are still exposed to secondhand smoke in their homes and communities. In apartment buildings that allow smoking, even if smokers are separated from non-smokers, or the apartment building is ventilated and the air is cleaned, people cannot avoid secondhand smoke. The only way to fully protect non-smokers from secondhand smoke indoors is to prevent all smoking in that building. Parents should protect their children by never smoking in the house. Also, don't allow anyone else to smoke in your home. Making your home smoke-free may be one of the most important things you can do for the health of your family. Dangerous levels of smoke can also build up quickly in cars. It's safest for children to ride in smoke-free cars. Non-smokers who breathe in secondhand smoke take in toxic chemicals just like smokers do. The more secondhand smoke you are exposed to, the more harmful chemicals that enter your body. So avoid all forms of tobacco smoke, and make sure your children do too.
Welcome back. You're watching ECHO. This program is about secondhand smoke. I'm your host, Lily McDonald, and we've brought along a couple of guests to talk more about this subject and share some information. We have Becky Brock here from the Association of Non-Smokers. Tell us a little bit about that organization.
Okay, the Association for Non-Smokers Minnesota, or ANSWER, is a nonprofit advocacy organization that's been around since 1973.
Wow, long time. And it's Betsy Brock, right?
Yes.
Thank you very much. I caught myself in retrospect. And then Kathy Stevens joins us. She's a LAMP fellow, and that's an acronym.
Yes.
So a LAMP is an acronym. Tell us a little bit about LAMP, please.
Okay, LAMP stands for the Leadership and Advocacy Institute to Advance Minnesota's Purity for Priority Populations. And basically what it is just a leadership development program designed to enhance communities' ability to address tobacco in our communities.
So LAMP Fellow is the
Yeah.
official title for the LAMP organization. Welcome, both of you. It's worth talking about your organizations because they do a lot of good work to educate people about secondhand smoke. Now, this particular program is dedicated to just that, secondhand smoke. And I know I've learned a lot in getting ready for this program on the issue, but let's define it first, okay? What exactly do we consider secondhand smoke?
Well, secondhand smoke is the smoke that's coming off the lighted end of a cigarette or a cigar, a pipe, or even a hookah. It's also the smoke that's exhaled by a smoker, so the smoke that's sort of in the air that you are inhaling, even if you're not smoking.
All right, so it's important to note secondhand smoke. And one question that came to my mind right away is you wouldn't think that secondhand smoke would be as dangerous in and around fresh air, but in fact it is. Right?
Yes, it is dangerous.
You know, there's indoors or outdoors, it doesn't matter. There's no safe level of tobacco smoke that you want to be around. Secondhand smoke is known to contain 10 toxins that can cause cancer. Also, there are over 250 known toxins, and 11 cancer-causing toxins.
Okay.
So there's really no safe exposure to secondhand smoke.
So we're talking about 11 cancer-causing toxins and over 250 known toxins. That's a lot of
Yes.
chemicals floating around in secondhand smoke, right?
Yes.
And that's what makes it dangerous. Now, is it automatic exposure that makes it dangerous, or is it extended exposure, or do we really know?
We really don't know what level of secondhand smoke can cause cancer, but there's really no safe levels of exposure. So in other words, you don't want to be exposed to secondhand smoke at all. At all. No, it's not safe.
Right, of course. And I know, of course, over time we've learned more about smoking in general and the dangers of smoking in general, and learning even more now about the secondhand smoke dangers as well. Some of the health effects, there are many, but what are some of the health effects that are bad for folks exposed to secondhand smoke?
Well, it can cause cancer. It can increase your risk for heart disease, lung disease. There's a lot of things that happen to children.
And it's believed to cause over 46,000 deaths each year from just being exposed to secondhand smoke in the U.S.
From secondhand smoke?
Secondhand smoke.
Wow, 46,000, that's a lot.
Yeah, that's a lot of people.
And are there differences now between adults and children in terms of the dangers?
Well, for children, because their lungs aren't quite as developed, there's more danger. Also, secondhand smoke exposure can cause SIDS, or sudden infant death syndrome. It also can cause more ear infections and colds, as well as pneumonia and bronchitis, and it is especially dangerous for children that have asthma to be exposed to secondhand smoke.
Right, so lots of respiratory illnesses
yes.
that can be prompted, provoked.
Yes, as a result of being exposed to the secondhand smoke.
Now, I know that, generationally, smoking used to be in fashion. We're talking decades ago. And, I've seen children kind of trapped in cars where parents are smoking, or someone in the family or friends are smoking, and you're kind of stuck when you're underage.
Yeah, and that's why it's really important that parents do not smoke in the car, because it's a small area, and to have that smoke trapped in that area really can have a negative health impact on the child if they're breathing in that
because
dangerous
their body
toxin.
systems are still building, and even a window open isn't enough.
It doesn't do enough.
So secondhand smoke, it's hard to stay away from secondhand smoke sometimes. Some of the places where we run into it.
Well, thankfully, back in 2007, it got a little bit easier because a law was passed that made nearly all workplaces smoke-free. But still people get exposed in their apartments, outside, in parks,
walking into
into office buildings, waiting on the bus sometimes, and then even at certain community events, people still smoke, and you might have your family at a community event, and you can still be exposed to secondhand smoke if there's people smoking at the event, even though it might be outside.
And it's not safe to be exposed to any secondhand smoke. You've said so. Is this where the Surgeon General weighs in on this?
Yes. In 2006, a report came out saying that there is no safe level of exposure. Things like ventilation don't help. So really the only way you can be protected is to have a smoke-free space.
Now, you mentioned that, I mentioned too that fresh air really doesn't make a difference, but so outdoors at all, and this may be why many municipalities are passing, smoke-free parks outdoors, because even secondhand smoke outside is not
dangerous.
good.
Yeah, and you would have to check with your local community to see what the ordinance is as far as smoking in parks.
So the air is not enough of a equalizer, if you will. The chemicals linger. How long do the chemicals linger? Is there any way of really knowing?
Yeah, it's hard to know, especially outdoors, how long. There's not a lot of good science on that right now. People are trying to figure out how to measure that, but
But safe to say, if you can see the smoke, smell the smoke, you don't want to be around the smoke.
Right.
Safe to say. It's a tough conversation to have sometimes with family members, too. If you have someone in the family who's, in your own home, you have the right to say, listen, please, no smoking here. If a workplace protects you by saying no smoking in the building. But I think sometimes people forget that they can ask. Can you help with some conversation how to ask the workplace, a landlord, or someone else about no smoking policies?
Well, I can just speak to, how you can talk to a family member about it. You can explain to them that you don't want smoking in your home, and you can give them the information and the reasons as to why, and explain that because of the toxins and chemicals, you don't want that in your home, because it's for the simple fact that the toxins and as a result of the smoke will linger in the home. And also you can let people know that you don't want them smoking in your car. You don't want your daycare provider to be smoking in their home, even though your children may not be present at the daycare while they're smoking. You need to let them know that you don't want smoking
Well, it's
in the
clearly
home.
worth investigating, too, when you're shopping around for daycares.
Yeah.
And I've seen some people will put placards, even in their cars, no smoking, please, and at home and workplaces as well.
Yes.
And you can ask, right?
Yeah, you can ask, and I think it's it's an important conversation to have. And I think if you explain the reason behind it, and as far as like the health effects, I think people will respect your wishes and not smoke in your home.
What about smoking areas around apartment complexes?
yeah, that's a lot of people are exposed in their apartment units. Smoke can travel very easily between one unit to another through your ventilation, your air conditioning, your heating, through little tiny cracks we can't even see.
Yeah, you may not even know if someone down the hall smokes, but you can smell something.
Right, and so that's one area where you can talk to your landlord. Landlords can make an entire building and all the units smoke-free. They can even make the outdoor areas smoke-free. So that's something that is really worth looking into. And there are smoke-free apartments available. You can look online.
So again, it is about building the relationships and building healthy environments around tobacco products, and knowing that you can say so. And most smokers will respect your request. It's just making that request known, and responding to that, and setting your environment up so that you're available, to letting folks know that message that you don't want the secondhand smoke or any smoking around. And for some people, it may be an awkward conversation, but it's a healthy conversation to have. What about Minnesota state laws? Now, this program is being produced in Minnesota, and folks watching, whether they're streaming it or have a copy from other states, have to check their own jurisdictions for information. But here in Minnesota, the laws are pretty clear. What are some of the laws around state laws on smoking inside or near any entrances?
There's no smoking in bars, restaurants, or common areas of hotels. No smoking on public transportation and taxis.
Yeah, nearly all workplaces, like she mentioned, are now smoke-free.
And does that matter if it's a government building, a public building, or a private building?
Yeah,
it is what it
matter.
is.
Yeah.
Okay.
Yeah.
So, yep, there are a few areas that are left out, like hotels. Like I said, outdoor workplaces aren't covered, so that leaves out a group of people too.
Okay. And if you have questions, local laws can restrict further some of the laws around smoking as well. So again, check in with local municipalities for what are the specific laws for building sites at the local level beyond the state laws that are already in place. And they may list them on their own website, or folks can also check freshairminnesota.org. So www.freshairminnesota.org. Where do you feel people in your community are exposed to secondhand smoke more often than not?
I would say in my community, I would say at community events, like a festival where there's music being played, a lot of times, people are smoking.
Yeah, concerts, for instance.
Yeah, outdoor venues, there's smoking. And in some parks where you don't have a smoke-free ordinance, you can be exposed to cigarette smoke there as well.
For the outdoor environments. And we mentioned entrances to buildings too. At lakes, in boats, I imagine too, there may be situations out there. I mean, there are rules for in the car, but even though you're fully exposed on a boat, I've seen folks traveling on the water too. And you may be going by, but the secondhand smoke is still very much with you. And again, it's a conversation to have with folks that you're with. Now, you mentioned cigarettes, cigars, pipes. I'm trying to remember all the different paraphernalia that can carry. And a hookah, that's a little new for me. It may have been around, but what's a hookah? And is one smoke different from the other? It's just a different format?
Well, hookah is basically a water pipe that you smoke tobacco in. It's usually kind of a social activity, and it's usually a long period of time they're using it, so like 30 to 90 minutes. So actually it ends up being a lot more smoke. I mean, usually it's a lot of smoke.
Is this a function of community or social events then where the secondhand smoke can be a problem for folks? And again, a request has to be made. Simple as that.
Yeah, or local ordinances can be put into place to prohibit it or...
Okay. Now, communities will do it. So I mentioned asking people not to smoke around you, be it the bus stop, workplace, or elsewhere. But parents can have a conversation with their children, too. And again, maybe not as easy a conversation because it's almost, kids will try different things at different ages. I mean, I remember trying smoking when I was a teenager and didn't really like it. But later did smoke and then finally quit. So it's a kind of an on and off rite of passage almost in some ways. But what are some things parents can talk to their children about?
I think parents can, have a conversation with their children and explain to them the dangers of smoking. And then also, with the internet and the kids like to be on different internet sites, I think that would be a good tool for them to use. To go online, just to help to get the message out. And then also, to go to websites where you can actually see pictures of, some of the dangers of smoking, some of the health effects. I think a lot of times with kids, having visuals can help them.
Yeah, I remember in health class when they brought this see-through model, let's say, and they put a cigarette in and got the model to draw on it, and you could actually see the smoke fill lungs and then leave a trace, which of course adds up over time to danger, if not a fatality situation. The visuals are really big, but back in my day, it was kind of cool to smoke. Is it cool to smoke today?
I have two teenage girls, and for them, it's not cool to smoke. I think, they know
that's
that.
Because mom doesn't.
That's that was the next thing. You have to be a role model.
Right.
If you don't want your children smoking, then it's important that you don't smoke. So they know I don't smoke. I do have a brother that was smoking, and they would get on him and say, you need to quit smoking, because they learned at school, and I talked to them about the dangers of smoking.
Yeah, and eventually I quit too. And again, it's a matter of learning. It's a matter of understanding and getting to understand the differences and the problems associated with smoking and secondhand smoking as well.
Yeah, I was going to say it's a really uphill battle when you're working with youth. I mean, they don't think about long-term consequences when they start smoking. So we know that a lot of what does prevent youth from never starting smoking is smoke-free policies and making non-smoking the community norm. So these policies are one of our most powerful tools.
Well, it's helpful structure. As I mentioned, back in my day, it was cool to smoke. We didn't know as much about it, so people did it. Now that we know, You quit and then you move on and trying to help others along the way. It is an educational piece. And providing, again, I don't want to say peer pressure, but it is that positive role model environment that sends a healthy message instead of a message that smoking is okay when it really isn't. And same for secondhand smoke as well. Setting those laws and just kind of how you want to handle it in your own home. Well, if you are a smoker or if you know a smoker, folks need to get information about not smoking and kicking the habit, if you will. Where does this conversation best take place? Because, quitting isn't easy, but it is doable with support. Where are some places to get support?
Well, I'd say one place that you could go is to your healthcare provider. Talk to your doctor or nurse practitioner about, how to stop smoking and what options are available to help you in that process.
Other places?
Yeah, you should start with your doctor. If you don't have a doctor, you don't have health insurance, every Minnesotan is eligible for quit plan services. So you can call the quit plan and receive, counseling, free medication. So that's another option.
So, and the website is quitplan.com, and the phone number, toll free, 888-354-7526. The telephone services are available in English and in Spanish. And I will have to plug programs like this, because it was a program like that actually helped me stop smoking and kick the habit. It is, again, learning your triggers, your personal triggers to the tobacco or the nicotine need that you're getting. And now, 25 years later, having not smoked, I can't imagine going back. So those programs are really good. And the triggers are different for every person, isn't it?
Yes, they are. For some people, like I remember when I was younger, and back in those times, you could smoke in the bars. So some people would say, I have to have a cigarette, to look cool, and then also because they were drinking alcohol. So I think, it was really good when the state eliminated smoking in bars, because even though I wasn't a smoker, when I would get home, I'd have to take my coat off and leave it on the porch just to let it air off. So I just think it's, it's really good that we have that positive.
Yeah, you just, you reminded me that sometimes going out socially, you do come home and you realize, oh, I was in a place where there was even a subtle amount of smoke. You can really notice it. And again, it's about coming together to give support to any person making a choice to quit the habit, to quit smoking, and to set some healthier guidelines for themselves and for others around them. So quitplan.com, and we'll also have that information on our website. That's www.echominnesota.org, and we provide information in different languages so we can help connect cultures to information about quit plan and also secondhand smoke and the reasons why it's not healthy to be around. Now, let's talk a little bit more about your programs. How specifically, as a LAMP fellow, do you get involved in helping folks understand more about secondhand smoke and stop smoking?
Yeah, the program that we worked on was dealing with window placement of advertising as far as the cigarette ads that were placed in the windows. We went around in certain communities and took pictures of the tobacco advertising in the windows, and then what we did is we met with some key community leaders in the African community as well as African American community to just really give them information about smoking, and also to provide information about the dangers of secondhand smoke. There were community meetings, like I said, at churches, at different health fairs, where we presented information about the dangers of smoking as well as the dangers of secondhand smoke.
And you mentioned it earlier, the visual can really make a big difference too, when folks can see the statistics of the health problems associated with secondhand smoke, as well as some of the steps to keeping your home smoke-free in workplaces and others. And it's also talking to people, too, hearing their story. Is that?
Yeah, I think that's really important, to talk to people and also to give people information and education, because a lot of times people are unaware of the dangerous effect of secondhand smoke. So it's really good to talk to people and to educate people and give them really good information.
Mm-hmm. And I'm sure you do as well, Betsy, with the Association for Non-Smokers, right?
Yes, we have a couple of programs that I think people might be interested in. We have Live Smoke Free, which connects renters to smoke-free buildings and also works with landlords. So we have a website where people can search for a smoke-free building. It's mnsmokefreehousing.org. Mm-hmm. And another program we have is called Tobacco-Free Youth Recreation. So we have a listing on that website of all the smoke-free parks in the area. So if people want to go to a smoke-free park, that's a good resource.
And more are doing just that. Well, thank you both very much for bringing us this information and for being with us on ECHO. We've talked about a lot of things, but we try to boil it down to 3 key messages. First off, being exposed to someone else's cigarette smoke can lead to many health problems and diseases. Second, secondhand smoke is especially dangerous for children. And last, number 3, please make sure your home and your car are smoke-free. Now, to get some ideas about the Quit Plan program or any one of the organizations we've mentioned on this program regarding smoke-free living, please visit echominnesota.org. We'll put them all together for you in a nice, neat website. For now, thank you all for watching and to both of you for being our guest on this program. I'm your host, Lillian McDonald. You've been watching ECHO. Until next time, make it a great day.
ECHO TV is a co-production of Minnesota's Emergency, Community, and Health Outreach Collaborative of Health, Safety, Emergency Preparedness, Ethnic and Nonprofit Agencies, and TPT's Minnesota Channel.